Your loved one feels a little off today. But what if it's not aging, not infection, and not harmless at all? This silent killer moves faster than fear, hides behind subtle signs, and steals lives before anyone realizes the race has already begun. Welcome to Wellness Unfolds, where we explore vital health topics to protect you and your loved ones from hidden dangers. Today, we are discussing a medical emergency that is often misunderstood, frequently missed, and incredibly dangerous for our elderly population. We are talking about sepsis, a condition that claims millions of lives every year, yet remains a mystery to many. For caregivers and family members, understanding this condition is not just knowledge, it is a critical tool for saving lives. Sepsis is a race against time, where every single minute counts, and early detection can mean the difference between life and death. Many people mistakenly believe that sepsis is simply a bad infection, but the reality is actually much more complex and terrifying. To understand the danger, we must first understand how our body usually fights off invaders, like bacteria, viruses, or fungi. Normally, your immune system releases chemicals into the bloodstream to fight the infection, a controlled battle to keep you safe. However, in sepsis, this process goes terribly wrong, causing a chain reaction that spirals completely out of control within the body. Instead of fighting the invader, the body's response becomes extreme, turning into a toxic storm that damages its own tissues. Think of it as a civil war, where the body's defense system starts attacking the very organs it is supposed to protect. This overreaction can lead to tissue damage, multiple organ failure, and eventually death if not treated immediately with aggressive medical care. While anyone can get sepsis, people over the age of 65 are at a significantly higher risk than the general population. As we age, our immune system naturally weakens, making it harder to fight off initial infections before they trigger sepsis. Furthermore, many seniors have chronic conditions like diabetes or kidney disease, which create a fertile ground for infections to escalate. It does not always start with a major illness. Sometimes a simple urinary tract infection or a small cut is enough. The biggest challenge is that symptoms in the elderly are often atypical, subtle, and easily mistaken for just being old. A young person might spike a high fever, but an elderly body might not have the energy to create that heat. This lack of obvious symptoms leads to delayed diagnosis, which is catastrophic because sepsis moves faster than you can imagine. Therefore, caregivers must become detectives, looking for specific clues that indicate the body is in a state of extreme distress. We have identified 5 critical signs that you must memorize to protect the vulnerable seniors in your life from this killer. The first sign involves body temperature, but it is not always the high fever that you might expect to see. While some may have a high fever, sepsis can strangely cause the body temperature to drop dangerously low, causing hypothermia. If your loved one feels intensely cold to the touch and cannot get warm, this is a massive red flag. This drop in temperature means the body is losing the battle and failing to maintain its own basic metabolic functions. Never ignore a lower than normal temperature in an elderly person who seems unwell. It is just as dangerous as fever. The second critical sign is a sudden change in heart rate and breathing pattern, even when the person is resting. If you notice they are short of breath or breathing very fast without any physical exertion, you must pay close attention. Their heart might be racing, beating much faster than usual, as it desperately tries to pump blood to vital organs. This is the body trying to compensate for the dropping blood pressure and the lack of oxygen reaching the tissues. Do not dismiss this as anxiety or just old age. A racing heart at rest is a scream for help. The third sign is perhaps the most important one for spotting sepsis in the elderly: a sudden change in mental state. If a loved one suddenly becomes confused, disoriented, or does not know where they are, this is a severe medical emergency. This sudden delirium happens because the brain is not getting enough blood flow and is being affected by toxins. Extreme sleepiness or being difficult to rouse is also a major warning sign that the brain is shutting down. The key here is the suddenness of the change. If they were fine yesterday and confused today, suspect sepsis immediately. Family members often mistake this for dementia or aging. But sepsis-induced confusion comes on fast, unlike the slow progress of dementia. The fourth sign is extreme physical sensation, often described as the worst pain or discomfort they have ever felt. Patients often report severe muscle pain or a generalized agony that feels different from their usual aches and pains. There is also a psychological symptom known as a sense of impending doom, where the patient feels they are dying. Listen to them if they say, "I feel like I am going to die," because their body is warning them. This specific type of anxiety and fear is a physiological response to the chemical storm raging inside their system. The fifth and final sign appears on the skin, providing a visual map of the circulation failure happening inside. Look for skin that becomes unusually pale, mottled, or discolored, often starting at the hands, feet, or knees. This marble-like pattern indicates that blood is not reaching the skin surface because the body is prioritizing the heart. You might also see a rash of tiny blood spots that does not fade when you press on it. Checking the skin all over the body is a vital step in identifying the poor circulation associated with septic shock. Remember these 5 signs: temperature, breathing, mental state, pain, and skin. Any combination of these requires immediate action. If you suspect sepsis, do not wait and see. Do not call a regular doctor. Call emergency services immediately. When you speak to the operator, say these exact words: "I suspect sepsis." This phrase changes everything for the responders. Using the word sepsis triggers a specific protocol, ensuring the medical team arrives prepared to treat a life-threatening emergency. In the hospital, doctors will race to administer antibiotics and fluids within the golden hour to stop the damage. Every hour of delay in getting antibiotics increases the risk of death significantly, so your quick action is vital. Sepsis is scary, but it is treatable if caught early. Your awareness is the best protection your loved ones have. Keep these symptoms in mind, trust your instincts, and never be afraid to ask medical professionals about sepsis. By understanding the signs and acting fast, we can prevent tragedy and keep our families whole and healthy together. Thank you for watching Wellness Unfolds. Please share this video to spread awareness and save lives in your community. Now that we have covered the basics, let us dive deeper into exactly why the elderly body struggles so much. Scientific studies show that T cells, the soldiers of our immune system, become less effective at identifying new threats as we age. The thymus gland, which produces these cells, shrinks with age, leaving seniors with fewer defenses against novel bacterial infections. This means bacteria can multiply silently for days before the body mounts a response, by which time it is too late. Physical barriers also weaken. Thinner skin and a reduced cough reflex allow bacteria to enter the lungs and blood easier. Pneumonia is the leading cause of sepsis in the elderly, often starting as a simple cold that rapidly escalates. Urinary tract infections are the second most common trigger, often going unnoticed until the infection spreads to the kidneys. For those who are bedbound, pressure ulcers or bed sores are dangerous open doors for bacteria to enter the bloodstream directly. Even medical devices like catheters or IV lines meant to help can introduce bacteria if not managed with strict hygiene. This is why hygiene is paramount. Simple hand washing is the first line of defense against introducing these deadly pathogens. Vaccines for flu and pneumonia are not just about preventing colds, they are essential shields against sepsis triggers. Proper nutrition and hydration also play a key role in keeping the immune system strong enough to resist initial infections. Encouraging movement and circulation helps prevent skin breakdown and keeps the lungs clear, reducing infection risks significantly. Communication within the family is crucial. Everyone involved in care must know the signs and the patient's normal baseline. Keeping a daily log of vitals helps you spot trends and notice when something deviates from the norm immediately. If you do make that emergency call, be ready to answer questions about their medical history and recent symptoms clearly. Tell the doctors if they have had a recent surgery, a fall, or an infection, as this connects the dots. Doctors will look for high lactate levels in the blood, a sure sign that cells are starving for oxygen. They will also monitor blood pressure closely, as a sudden drop indicates the body is entering the dangerous shock phase. Septic shock is the final stage where organs fail completely. Our goal is to catch it before it reaches here. Survivors of sepsis often face a long recovery road, dealing with muscle weakness, fatigue, and memory issues for months. This is called post-sepsis syndrome, and understanding it helps caregivers provide the right support during the rehabilitation process. Patience is key during recovery. The body has been through a war and needs significant time and rest to rebuild. Emotional support is just as important, as many survivors experience anxiety or depression after such a terrifying health event. Connecting with support groups can help both survivors and caregivers navigate the complexities of life after a sepsis diagnosis. To summarize our journey today, prevent infections where possible, recognize the subtle signs early, and act immediately without hesitation. Your vigilance protects the stories, the wisdom, and the love that our elders bring to our lives every day. You are now armed with the knowledge to be a guardian, to see the invisible, and to speak for the silent. Let us make hygiene and health monitoring a daily habit, not just a reaction to illness, but a lifestyle choice. Check your home medical kit today. Ensure you have a working thermometer and a pulse oximeter ready for use. A pulse oximeter is an affordable tool that can help you track oxygen levels and heart rate objectively at home. If the reading drops below 95% or the heart rate spikes, use this data when you call for help. Never try to treat suspected sepsis at home with leftover antibiotics. This requires hospital-grade treatment administered directly into the veins. Dehydration can mimic some symptoms and worsen others, so keeping your loved ones hydrated is a simple but powerful defense. Pay attention to small changes like a sudden loss of appetite or a lack of interest in favorite activities. You know your loved one better than anyone. If your gut tells you something is wrong, trust it and act. Medical professionals appreciate engaged caregivers who provide clear, accurate information. You are an essential part of the medical team. Let us review one last time. Extreme shivering or cold skin is not just being chilly, it is a warning sign. Breathing that is fast and shallow indicates the body is starving for oxygen and struggling to maintain its balance. Sudden confusion is the brain's way of telling you that the blood flow is compromised and toxins are accumulating. Unexplained, severe pain that feels like the worst ever is a signal of systemic inflammation that cannot be ignored. Skin that changes color or looks mottled is the visible evidence that the body is shutting down blood to extremities. Sepsis is a formidable enemy, but with knowledge and speed, it is a battle that can absolutely be won. Share this knowledge with your friends, your neighbors, and your community. You never know whose life you might save. Establish a good relationship with a primary care doctor who knows your loved one's history and can advise you. Being prepared means having a list of current medications and medical history packed and ready for any sudden hospital trips. This simple piece of paper saves precious minutes in the emergency room when you might be too stressed to remember. Panic is the enemy of action. Staying calm allows you to observe clearly and communicate effectively with medical teams. Knowledge is the light that pushes back the darkness of fear. You are no longer helpless against this silent threat. Our goal is not just survival, but maintaining the quality of life and dignity for our aging population. For those with advanced illness, having conversations about care preferences early ensures their wishes are respected during emergencies. Ensure legal documents like healthcare proxies are in order, so you have the authority to make decisions if needed. Every senior has a lifetime of stories and experiences. Protecting their health is a way of honoring their contribution. Be especially vigilant during flu season or winter months when respiratory infections are rampant and immune systems are stressed. Keeping seniors warm and protected from extreme weather helps conserve their energy for maintaining a strong immune system. Do not let a small cut become a big problem. Clean and dress wounds immediately and monitor them for redness. If a wound becomes hot, red, swollen, or starts oozing, consult a doctor before it spreads to the blood. Modern technology like smartwatches can also provide alerts for unusual heart rates, adding another layer of safety. However, technology never replaces human observation. Look at the person, not just the numbers on a screen. Caregiving is exhausting work. Ensure you are also taking care of yourself so you can be there for them. A burnt-out caregiver might miss subtle signs, so do not hesitate to ask for help from other family members. Remember the path. It starts with an infection, triggers an extreme reaction, and leads to organ damage if unchecked. You have the power to break this chain at the reaction stage, preventing the organ damage that follows. A common question is whether sepsis is contagious. No, you cannot catch sepsis, but you can catch the infection that causes it. That is why preventing the spread of germs in the home protects everyone from the initial trigger of infection. We must also use antibiotics responsibly to ensure they remain effective tools when we really need them for sepsis. Always finish prescribed antibiotic courses completely to prevent surviving bacteria from becoming stronger and causing a relapse. Be aware that having sepsis once increases the risk of getting it again, so continued vigilance is necessary. Focus on an anti-inflammatory diet rich in fruits and vegetables to help the body repair itself after recovery. Prioritize good sleep hygiene, as deep sleep is when the immune system performs its most critical maintenance work. Chronic stress weakens immunity, so creating a calm, peaceful environment is actually a form of medical prevention. Loneliness can also impact health, so keep your loved ones connected to family and friends as much as possible. Remember, you are not alone in this journey. Millions of caregivers are learning and adapting just like you are. For more detailed information, consult resources from trusted health organizations like the Sepsis Alliance or the CDC. Never be afraid to ask questions. In medicine, a stupid question is better than a silent mistake. Your dedication to learning about sepsis is a testament to your love and commitment to those you care for. With awareness comes power. The power to turn a potential tragedy into a story of survival and resilience. We have covered definitions, risks, symptoms, and actions. You now have a complete toolkit to face this challenge. If there is one thing to take away, it is this: when in doubt, check it out. Speed saves lives. We also want to acknowledge the tireless work of medical professionals who fight sepsis in hospitals every single day. And to you, the caregivers, thank you for your vigilance, your patience, and your boundless love for your family. If you found this video helpful, please subscribe to Wellness Unfolds for more life-saving health guides and medical insights. Share your own stories or questions in the comments below. Your experience might help someone else spot the signs. Check out our next video on boosting immunity in seniors naturally to prevent infections before they even start. Take a moment to breathe and process this information. You are doing a great job caring for your loved ones. Let us walk this path of health and wellness together, ensuring that our golden years are safe and happy. There is a profound peace of mind that comes from knowing you are prepared for whatever health challenges arise. Together, we can reduce the impact of sepsis and protect the most vulnerable members of our society effectively. Health is truly our greatest wealth, and protecting it requires constant learning, attention, and proactive care from everyone involved. Thank you for trusting us with your time today. We hope this guide empowers you to act with confidence. Please remember this video is for educational purposes only and does not replace professional medical advice from your doctor. Stay vigilant, stay healthy, and keep unfolding the secrets to a better life with us here at Wellness Unfolds. Until next time, take care of yourself and each other. This is Wellness Unfolds, signing off. Goodbye and be well.